Hello friends, welcome back to my channel. This video is about the 20th notebook of Ortho subject for Neet PG exam. Starting with simple bone cyst, it is seen in 4 to 10 years of age. We can see fallen fragment sign or fallen leaf sign on X-ray. It is a benign unilocular cyst filled with straw-colored serosanguineous fluid. Most common site of simple bone cyst is proximal humerus. Pathological fractures are seen here. Trapdoor sign is present. Chronic osteomyelitis case is like there is a history of accident 2 years back, and pain and swelling is seen at the site of injury. On X-ray we can see sequestrum and involucrum on tibia. What is sequestrum? Sequestrum is a dead bone. Involucrum is a dense new sclerotic bone surrounding the sequestrum. Cloaca is perforations in the involucrum. Osteogenic sarcoma, we can see sunburst appearance. Having sarcoma, it is seen in 4 to 25 years of age. It mainly affects the diaphysis. We can see onion skin appearance of periosteum. In multiple myeloma, there is multiple punched out lesions of bone. Articular pain means pain both on active and passive movement. Painful on active movement as well as painless on passive movement. On a patient with history of musculoskeletal pain, patient's age is 35 years, he is a male patient. The main type of pain is non-articular. Why we are saying it as non-articular pain? Because swelling, crepitation, instability as well as deformity all are absent. Next is sequestrum. It is a piece of dead bone. Sequestrum is a nidus for infection. Abscess as well as persistent pus discharge in bone can be seen. Distal radius is the most common fracture in childhood. Clavicle fracture is the most common fracture in birth. Next is about sprengal deformity. It is the congenital elevation of scapula. Abnormally high, smaller, prominent scapula. Neck will be shorter. Kyphosis or scoliosis of upper thoracic spine is seen. Shoulder movement is painless. Abduction and elevation is limited due to scapular fixation. Sprengal deformity is associated with Klippel-Feil syndrome, kyphosis, scoliosis, cervical rib, renal abnormalities, spina bifida, omovertebral bar, diastematomyelia as well as torticollis. De Quervain's disease, it is the rupture of extensor pollicis brevis as well as abductor pollicis longus. Positive Finkelstein test is seen in De Quervain's disease. It is seen in females and also mainly in childbearing age. Pain as well as tenderness at the tip of the radial styloid is seen here. Treatment of De Quervain's disease is conservative treatment with splinting and steroid injections. In few patients, we do few release that of first dorsal compartment. Fracture of the arm, the capillary refill time in fingers is 5 seconds. It is an urgent evaluation for compartment syndrome and potential vascular injury. Popcorn calcification or coma-shaped calcification or punctate calcification is seen in chondrosarcoma. Onion peel appearance is seen in Evans sarcoma. Soap bubble appearance is seen in giant cell tumor as well as adamantinoma. Ground glass appearance or shepherd's crook deformity is seen in fibrous dysplasia. Stippled or punctate calcification is seen in chondroblastoma. Moth-eaten bone is seen in multiple myeloma. Winging owl sign is seen in vertebral metastasis. Treatment for hypertrophic non-union following fracture is stabilization, mainly for union. Scaphoid is the most common fracture carpal bone after fall on outstretched hand. Hypertrophic non-union without deformity, conservative treatment with functional bracing or rigid fixation alone is done. For atrophic non-union, we do fixation as well as excision of fibrous tissue in fracture gap and also in sclerotic ends, followed by application of bone grafts around the fracture. Example for non-union is proximal scaphoid fracture. Painful arc syndrome is also known as impingement syndrome. Angle is 60 to 120 degree. Abduction, there will be pain present. Painful arc syndrome or impingement syndrome includes fracture greater tuberosity, supraspinatus tendinitis 60 to 90 degree, subacromial bursitis 60 to 90 degree, partial tear of supraspinatus. Disruption of perforating vascular and lymphatic vessels show hemolymphatic collection between facial planes known as Morel Lavelle lesion. Treatment is IV fluorescein indocyanine green. Next is degloving injury. It mainly affects the skin as well as subcutaneous fat, which is stripped from underlying fascia. Rheumatoid arthritis treatment is methotrexate with anti-TNF. Spondylolisthesis, it is the anterior translation of one vertebra over another, that is L5 to S1 followed by L4 to L5. Beheaded Scottish Terrier sign is a break in pars interarticularis. Port spine mainly affects the TB spine, secondary pulmonary or GI primary, which spreads through Batson's plexus of veins, that is paravertebral plexus. It also affects the dorsolateral region. 60-year-old female patient complains with low backache. On lumbar CT, there is ballooning of IV disc into adjacent vertebra, which showed biconcave shaped vertebral body as well as biconvex shape of disc. Codfish appearance is seen here. Diagnosis is osteoporosis. There is decrease in bone matrix, decreased mineralization, decreased bone density, decreased bone mass. Investigations include DEXA scan, which is the gold standard investigation. It helps in quantification of bone mass. And next investigation is T-score. In osteoporosis, T-score minus 2.5 or lower is seen. There will be collapse of vertical height of vertebra. Ground glass appearance of bone is seen here in osteoporosis. Picture frame vertebra is seen in osteoporosis. Ghost vertebra is seen in osteoporosis. Port spine, which is also known as TB spine, there will be reduction in the disc space, which is the earliest sign. Vertebral body destruction happens here. Cold abscess or paravertebral abscess is seen in TB spine. Advanced destruction and wedging of vertebra is seen in TB spine. Giant cell tumor, which is also known as osteoclastoma, it is a benign tumor. It is expansile, eccentric, multiloculated lytic lesion. Soap bubble appearance can be seen on X-ray. Most common location is distal femur followed by proximal tibia. Treatment includes extended curettage, bone grafting, bisphosphonates, radiotherapy, cryotherapy. GCT, that is giant cell tumor, affects the metaphysis or epiphysis of long bones. Age group which affects giant cell tumor is 20 to 45 years of age. Z score mainly depends on the age, sex, ethnicity, and check the disease. That means when Z score is -2 or reduced, we should check about the disease. T score -1 or if it is increased, it is normal. If T score is in between -1 and -2.5, it is osteopenia. If T score is -2.5 or reduced, it is osteoporosis. March fracture or stress fracture, it is mainly fracture in the neck of second or third metatarsal. Boxer's fracture, it is the break in metacarpal neck, that means in the fifth finger after blow with fist. Aneurysmal bone cyst is eccentric multiloculated lytic tumor. It is seen in adolescence, mainly affects the metaphysis. Fluid sign is positive in aneurysmal bone cyst. Treatment of aneurysmal bone cyst is simple curettage with or without bone graft. Jersey finger is the avulsion injury of flexion digitorum profundus. There will be sudden hyperextension of distal joint. Trigger finger is there will be a nodule on flexor tendon inhibiting the moving along A1 pulley. Port's fracture is bimalleolar angle fracture. Cotton's fracture is trimalleolar angle fracture. Chopard's fracture is fracture between talonavicular and calcaneocuboid joints. Aviator fracture is fracture neck of talus. Baseball finger is also known as mallet finger. It is due to disruption to extensor tendon at distal interphalangeal joint. Gamekeeper's thumb is the damage of ulnar collateral ligament. Jones fracture is extra-articular fracture of base of fifth metatarsal. Tillog's fracture is avulsion fracture of tibia by anterior tibiofibular ligament. Scoliosis, we can see Cobb's angle more than 10%. Here Nash and Moyes method as well as Per Drioli and Weidel method is used to assess vertebral rotation in scoliosis. Aviator fracture is the fracture neck of talus. Bowman's angle is the angle line through lateral epiphysis and long axis of humerus. Normal Bowman's angle is less than 80 degree, that is 80. Less than 80 degree is the normal Bowman's angle. Bowman's angle increases in supracondylar fractures. Next is Ferguson's angle. Normal Ferguson's angle is 34 degree. Ferguson's angle is the angle between the upper end plate of S1 vertebra and horizontal plane. Decreased Ferguson angle is seen in advanced spondylolisthesis. Next is Bowler's angle. It is the angle formed by two lines tangent to the highest points of anterior and posterior facets of calcaneum. Bowler's angle is decreased in calcaneal fractures. Bowler's angle as well as Gisein's angle is seen in fracture of calcaneum. Next is kite angle. Kite angle is seen in congenital talipes equinus varus, that is CTEV. Carrying angle is seen in cubitus varus as well as cubitus valgus. Next is about osteosarcoma. It is pleomorphic tumor cells, hyperchromatic nuclei, unmineralized osteoid, abundant mitosis, unmineralized osteoid or mineralized bone, that means fine and lace-like appearance. These all are features seen in osteosarcoma. Ewing sarcoma, important points are small round cells, scant cytoplasm, increase in glycogen. In Ewing sarcoma, we can see Homer-right rosettes. Osteoblastoma, there is interconnecting trabeculae of woven bone. A patient came with pain in the hand, and about the joints, proximal interphalangeal joint, distal interphalangeal joint and first carpo-metacarpal joints are affected. Elbow, wrist, ankle, metacarpophalangeal joint, these all are spared. Diagnosis is osteoarthritis of hand. So in osteoarthritis of hand, proximal interphalangeal joint, distal interphalangeal joint, first carpo-metacarpal joint, these all are affected. Distal interphalangeal joint, there is a nodule palpable. It is known as Heberden's nodes. In proximal interphalangeal joint, palpable nodule is Bouchard's node. In rheumatoid arthritis, there is sparing of distal interphalangeal joint. In psoriatic arthritis, proximal interphalangeal joint, distal interphalangeal joint, metacarpophalangeal joint, all these are affected. In pseudo gout, knee joint is most common affected one. Knee joint more than wrist joint is affected in pseudo gout. Next is a case. A maid was playing with a child holding his hands, and in between playing the child cried for few hours and he did not use his arm. He doesn't let anyone touch his hand. So here there was dislocation of radial head over the annular ligament. This diagnosis is pulled elbow or nursemaid's elbow. There is axial traction on extended and pronated forearm. Tennis elbow is lateral epicondylitis involving common extensor origin. Golfer's elbow is medial epicondylitis involving common flexor pronator origin. Miner's elbow or student's elbow is olecranon bursitis. Next is a patient who was admitted in ICU who had fracture femur. Saturation was 60%. Patient was in a state of confusion. Lung field was clear. restlessness, tachycardia, fever, breathlessness, petechiae all were present in the patient. The diagnosis is fat embolism. Here in fat embolism, important thing that we should remember is GERD criteria. 2 major or 1 major plus 4 minor criteria should be present to diagnose fat embolism. Investigation include urine analysis, which include fat globules. Next is blood PO2 level. Treatment for fat embolism is oxygen therapy, stabilization of the long bone fracture. Next is a case, a patient who had history of lower backache and early morning stiffness for 2 years, bilateral heel pain and foot strain for 6 months. Patient who was a male patient, HLA-B27 was present. Diagnosis is ankylosing spondylitis. The patient had ankylosing spondylitis. So in this condition, ankylosing spondylitis is associated with iritis, aortic incompetence, pericarditis, apical lobe fibrosis, generalized osteoporosis, atlantoaxial joint subluxation. There will be restriction of the normal lumbar lordosis, increased thoracic kyphosis, decreased spinal movements are seen here, decreased chest expansion is seen here. On X-ray, there will be erosion and fuzziness of sacroiliac joint. Squaring of the vertebral body is seen in ankylosing spondylitis. Bamboo spine appearance is seen in ankylosing spondylitis. Investigations include positive Fletcher's test, Pumple handle test, pelvic compression test as well as Faber's test. Next case is a patient came with complaints of bilateral knee joint pain, swelling of knees and ankles, pseudoparalysis. This is a condition of scurvy which is due to vitamin C deficiency. Here there is hydroxylation of lysine and proline in procollagen. In scurvy, important things that we should remember is pelican spurs, Trummerfeld zone, Frankel's line, perifollicular hemorrhages, Wimberger's ring sign, sclerotic rim epiphysis. Again, telling about the features of scurvy: epistaxis, gum bleeding, poor wound healing, poor fracture healing, hyperkeratosis of hair follicles, scorbutic rosary, costochondral separation, tender nodules, heme arthrosis, subperiosteal hemorrhage, periosteal reaction or periosteal elevation, pencil point cortex, generalized osteopenia, cortical thinning. These all are things seen in scurvy. Next is about rickets, which is due to vitamin D deficiency. In rickets, we can see loss of provisional zone of calcification. There is reduced appearance of epiphysis, widening of growth plate, bowing of legs, cupping of metaphysis, fraying, pectus carinatum, bowing of diaphysis with thinning of cortices, delayed closure of fontanelles, healing rickets, zone of calcification is denser, rachitic rosary, alopecia, craniotabes, frontal bossing, scoliosis, fractures, dental anomalies, Harrison sulcus. These all are the things we should remember in rickets. Next is about metaphyseal dysplasia. It is an autosomal recessive condition. We can see genu valgum here. Metaphyseal dysplasia is also known as Pyles disease, Pyles, Pyles disease. It is due to failure of remodeling of metaphysis. Erlenmeyer flask is seen in metaphyseal dysplasia, that is, there is deformities of distal femur as well as proximal tibia. It is known as Erlenmeyer flask deformities. Next is pycnodystosis. It is an autosomal recessive condition. Pycnodystosis, there is mutation of cathepsin K gene, that is, there is mutation of CTSK gene, cathepsin K gene. Pycnodystosis causes osteosclerosis. Patient will be having short stature. If radial nerve is affected, we can see thumb drop, finger drop as well as wrist drop. Thumb drop and finger drop affects the extensors, which is supplied by posterior interosseous nerve. Wrist drop is mainly affects the extensors of the wrist. Next about the median nerve, we can see ape thumb deformity which affects the thenar muscles. Pen test is done to examine the abductor pollicis brevis. Pincer grasp or Kelo-Nevin sign is used to examine flexor digitorum profundus as well as flexor pollicis longus. Pointing index or Ochsner's clap or benediction test is used to examine flexor digitorum superficialis as well as flexor digitorum profundus. So all these tests, that is pen test, pointing index sign or Ochsner clap test, benediction test, these all are done to examine the median nerve. Flexor pollicis longus is supplied by anterior introitious nerve. On anterior dislocation of hip, there is deceleration injury. History will be fall from height. Length of the limb will be lengthened. Femoral nerve will be injured. Anterior or inferior shoulder dislocation, there will be injury to axillary nerve, that is circumflex humeral nerve of axillary nerve will be affected. Shaft of humerus fracture mainly affects the radial nerve. Supracondylar fracture humerus affects the anterior introitious nerve more than median nerve more than radial nerve. So supracondylar fracture humerus case, the nerve affected will be anterior introitious nerve. Ulnar nerve examination, we do book test, card test, Foreman's sign, Igawa test. Book test is done to assess adductor pollicis. Card test is done to assess palmar introche. Foreman's sign is done to assess flexor pollicis. Igawa test is done to assess dorsal introche. So book test, card test, Foreman's sign, Igawa test, these all are done to assess the ulnar nerve. Posterior dislocation of hip, there will be dashboard injury. Length of the limb will be shortened. Sciatic nerve is injured. Monteggia fracture is fracture which affects the posterior introitious nerve. Workman's ischemic contracture mainly affects the anterior introitious nerve. Knee dislocation is due to common peroneal nerve. Lunate dislocation mainly affects the median nerve. Anterior dislocation of hip mainly is by deceleration injury, fall from height, length of the limb will be lengthened, femoral nerve will be injured. Next is multiple enchondromas or Olier's disease. It is also known as Maffucci syndrome. There will be multiple calcified lesions in the fingers. There is soft tissue hemangioma present here in multiple enchondromas, mainly affects the metaphysis. Shortening, angular deformity as well as pathological fractures are seen in multiple enchondroma or Olier's disease or Maffucci syndrome. On histopathology, we can see benign as well as chondrocytes and also hyaline cartilage. Hyaline cartilage which is benign as well as which is full of chondrocytes. On X-ray, we can see intralesional calcifications with popcorn appearance. Treatment for multiple enchondroma or Olier's disease is osteotomy. Next is about fibrous dysplasia. Bone with fibrous tissue with well-defined sclerotic rim is seen here. On X-ray, we can see ground glass appearance with well-defined sclerotic rim. Fibrous dysplasia is associated with McCune-Albright syndrome. Shepherd's crook deformity is seen in proximal femur. Multiple exostosis is an autosomal dominant condition. Multiple exostosis is a type of osteochondroma. Multiple exostosis mainly affects the phalanx, scaphoid as well as metacarpals. On X-ray, we can see bony erosions on multiple exostosis. Treatment is excision. Next is about air embolism. There will be severe hypotension, hypoxemia. Patient will be placed in Trendelenburg left lateral decubitus position. Periarticular fracture of knee, we use spanning fixator. External fixator is used in the fracture associated with severe soft tissue damage. Marfan syndrome is an autosomal dominant condition. Patient with tall, long limbs as well as long digits, spontaneous pneumothorax, aortic dissection, lens dislocation, In Marfan syndrome, there is early diastolic murmur. Next is about fat embolism. It is seen in a patient who has a fracture. Within 72 hours, fat embolism can be seen. Fat globules originating from bone marrow following fracture of long bones. Next is intrauterine scan of 30th week of pregnancy. We can see a fetus with multiple long bone fracture. Diagnosis is osteogenesis imperfecta. There is abnormal type 1 collagen. Protrusia acetibuli, vermian bones, blue sclera, proximal femoral, shepherd's crook deformity of femur, increased fragility of bones, hearing loss. These all are seen in osteogenesis imperfecta. Treatment for osteogenesis imperfecta is bisphosphonates, physiotherapy as well as walking aids. Normal valgus, that is elbow carrying angle, is 5 to 15 degrees. 5 to 15, 1 5, 5 to 15 degrees. Untreated lateral condyle of humerus fracture, we can see three things which include cubitus valgus, malunion as well as recurrent dislocations. These three are the complication of untreated lateral condyle of humerus fracture. In cubitus valgus, we can see Salter-Harris type 4 injury. In cubitus valgus, that is on falling on extended elbow, we can see features of ulnar nerve palsy. Displaced fracture means we should do reduction as well as internal fixation. So the three complications of untreated lateral condyle of humerus fracture include cubitus valgus, malunion as well as recurrent dislocations. Next is cubitus varus deformity. It is the gun stock deformity. There will be malunion of the supracondylar fracture, and also the important complication is injury to brachial artery. Next is a case, a patient who had recurrent respiratory infection, pain on the knee, high fever, peripheral smear showed sickle cell anemia. On X-ray there was lytic as well as sclerotic bone. Diagnosis is acute osteomyelitis. Most common organism which affects this acute osteomyelitis is Staphylococcus aureus. If the patient has sickle cell anemia, most common organism causing acute osteomyelitis is Salmonella. Otherwise, the most common organism causing acute osteomyelitis is Staphylococcus aureus. On X-ray, periosteal reaction as well as bony destruction after 10 to 12 days of infection can be seen. Treatment for acute osteomyelitis include empirical antibiotic therapy. Surgical drainage is done for abscess. Next is Cocup splint. It is used for radial nerve injury. In case of radial nerve palsy, that means patient will be having inability to dorsiflex the wrist and digits. Patient will be having wrist drop as well as finger drop. So Cocup splint is given. Next is median nerve injury. Patient will be having carpal tunnel syndrome, inability to prolonged flexion or extension of the wrist. So inability of the prolonged flexion or extension of wrist, we give nocturnal wrist splinting. Ulnar nerve injury or ulnar claw hand, we give knuckle bender splint to prevent metacarpophalangeal hyperextension. Volkmann's ischemic contracture, most commonly seen following supracondylar humeral fracture. It is treated with Volkmann's splint or turnbuckle splint. Dennis Brown splint is given for CTEV. Milwaukee brace or Boston brace is given for scoliosis. Somi brace, Somi brace is given for cervical spine injury. ASH, that is anterior spinal hyperextension brace, ASHE brace, is given for dorso-lumbar spinal injury. Next is a case, a patient came with chronic knee pain. There is no history of trauma. When we took the X-ray, we can see two pieces of patella. This condition is known as bipartite fracture patella. It is also known as two-part patella. Here we should, as an investigation, we should take the X-ray of the other knee also. There are three types for this bipartite fracture patella. Type 1 is the parted patella will be seen in inferior pole. This is seen only for 5% cases. Type 2 is 20%, that means the lateral border of patella is separated. Next is type 3 bipartite patella. It is seen in 75% of the cases. It is the most common type. Superolateral portion of the patella is separated here. So this type 3 bipartite patella is the most common among the bipartite fracture patella. Diagnosis is by skyline view, that is squatting weight bearing position. This is done to assess if pain is caused by non-union at bipartite site. MRI is not required to diagnose this condition. Next is a patient who had a troubled sleep at night. There is numbness and tingling sensation on the lateral 3 digits. Symptoms get relieved as he lays arms hanging from bed. Diagnosis is carpal tunnel syndrome. Derkin's test, that is direct compression of median nerve for 30 seconds. Here there will be pain and paresthesia over radial 3.5 digits. Carpal tunnel syndrome is most common entrapment mononeuropathy. There is compression of median nerve. Diagnosis is nerve conduction studies. Other tests for carpal tunnel syndrome include Fallon's test as well as Tinel sign. Non-surgical treatment of carpal tunnel syndrome include wrist splinting, activity modification, NSAIDs, corticosteroid injections, physical as well as occupational treatment. If the above non-surgical treatments fail, we should do carpal tunnel release surgery. Pronator teres syndrome affects the median nerve. Cubital tunnel syndrome affects the ulnar nerve behind medial epicondyle. Guyon's canal, which is also known as fibro-osseous canal, it is 4 cm long in adult. Guyon's canal includes ulnar nerve plus ulnar artery. Ulnar nerve injury, there is flexion at interphalangeal joint. For ulnar nerve injury, we do Fromen's test or book test. Here a book is kept between thumb and index finger. There will be weakness of adductor pollicis muscle. Adduction of the thumb is lost here. Next is radial tunnel syndrome, which is also known as arcade of Froese. It mainly affects the posterior interosseous nerve in proximal forearm. Tarsal tunnel syndrome affects the posterior tibial nerve. Chiralgia paresthetica or Wartenberg syndrome affects the superficial sensory branch of radial nerve. Polyostotic fibrous dysplasia is associated with McAlbright-McCune syndrome. Notalgia paresthetica includes pruritus as well as dysesthesia. Deformity in lower limb, hypersegmented skin lesions, and on X-ray thigh there is bending of femur. That is shepherd's crook deformity. Diagnosis is fibrous dysplasia of proximal femur. There is replacement of bone with fibrous tissue in fibrous dysplasia. X-ray finding in fibrous dysplasia is hazy ground glass appearance, shepherd's crook deformity. There is expansion of marked varus in proximal femur. Well-defined expansile intramedullary lesions are seen here. Hawkins classification we use in talus fracture. In fracture fibula neck, there will be high stepping gait. Foot drop is caused due to injury to common fibular nerve, also known as common peroneal nerve. Fracture of proximal humerus we classify by Neer classification. Galeazzi fracture dislocation, there is interosseous membrane tear with triangular fibrocartilage complex tear as well as radial shaft fracture. Haglund deformity is seen in ankle joint. Most common form of arthritis is osteoarthritis. Ankylosing spondylitis is bilateral sacroiliitis. Bone formation is non-union, which includes bone morphogenic protein. Counterforce brace is used in tennis elbow. Tubular sequestrum is seen in osteomyelitis. Ring sequestrum is spine tract infection. Fishtail deformity is seen in distal end of humerus fracture. Langerhans cell histiocytosis, chondroblastoma. In these two conditions, there is CD1A marker. Most common pattern of port spine is paradiscal. DEXA scan is used in patients of 65 years of age. Thomas test is done for flexion contracture of hip. In cubitus varus deformity, we do lateral closed wedge osteotomy or French osteotomy. Next is about giant cell tumor. Soap bubble appearance is seen in giant cell tumor. Lesion is eccentric expansile lobulated lytic lesion with non-sclerotic borders. Classification is enchondral ossification. Enchondral ossification, we can see the different classification, that means by stages it is classified as stage of induction, stage of inflammation, stage of soft callus, stage of hard callus, stage of remodeling. In stage of soft callus there is fracture deformable which is not displaceable. In stage of hard callus we can see membranous ossification. Ewing sarcoma is the most radiosensitive tumor. Most radiosensitive other tumors include lymphoma, seminoma, myeloma, Wilms tumor. Most radioresistant tumor includes melanoma, osteosarcoma, hepatic carcinoma, pancreatic carcinoma, renal cell carcinoma. Smith's fracture is also known as reverse Colles fracture. It is the fracture of the distal radius with palmar angulation of distal bone. In Klippel-Feil syndrome, there is low posterior hairline, short webbed neck as well as restriction of neck movements. Galeazzi fracture is oblique fracture of the lower third of radius with dislocation of distal radial ulnar joint. Montague fracture is the fracture of shaft ulna with dislocation of proximal radial ulnar joint. Next is about Perthes disease. Patient will be having pain, limping, abduction with internal rotation is always limited, flexion of the leg. These all are seen in Perthes disease. There will be mushroom shaped femoral head. On X-ray, Perthes disease shows necrotic phase, fragmentation phase, reossification phase, healing phase. Next is about the TB hip. In TB hip there are 4 stages: stage of synovitis, stage of early arthritis, stage of advanced arthritis, stage of arthritis with subluxation. In stage of synovitis we can see abduction, stage of early arthritis we can see adduction, stage of arthritis with subluxation we can see mortar and pestle hip or wandering acetabulum. In posterior dislocation of hip joint, sciatic nerve is affected. Vascular sign of Narath is mainly noted. The movements during posterior dislocation of hip joint is like FADIR, FADIR, that is flexion, adduction, internal rotation. FADIR is seen in posterior dislocation of hip joint. In ganglion cyst, there will be painless, well-defined cystic transillumination present. Froment sign is weakness of adductor pollicis muscle. In spondylolisthesis, there is palpable step in lumbosacral spine. There is break in pars interarticularis of L4 vertebra which shows B-headed Scottish Terrier. In scaphoid fracture, we put glass holding position, that is scaphoid cast. In scoliosis, we use recess cast or turnbuckle cast. Congenital vertical talus deformity, that is CTEV, is also known as rocker bottom foot. Treatment is manipulation and cast by Ponseti method. First line treatment for CTEV is Ponseti technique. Reduction of Colles fracture include counter traction, traction, palmar flexion to correct dorsal tilt, that is PD, palmar flexion to correct dorsal tilt. Next is ulnar deviation to correct radial tilt, UR, ulnar deviation to correct radial tilt. So, reduction of Colles fracture include counter traction, traction, palmar flexion, ulnar deviation. palmar flexion for D, PD, and ulnar deviation UR, radial tilt. Next is Hutchinson fracture or Chauffeur's fracture is the fracture of radial styloid. Next is a case, a patient who has a fractured neck of femur. We can see break in Shenton's line, break in trabecular stream. Within 3 weeks, that means in a patient with less than 65 years of age and the fracture neck of femur within 3 weeks, we do closed reduction internal fixation with cancellous screw. After 3 weeks of this fracture, as well as patient is below 65 years of age, we do MRI and also we do McMurray osteotomy, Powell's osteotomy or Meyer's operation. If the patient is above 65 years of age, we do hemiarthroplasty. If acetabulum is normal and if patient is more than 65 years of age and if acetabulum is not normal, we do total hip replacement. Displacements of Colles fracture include dorsal tilt, dorsal shift, lateral tilt, lateral shift, supination, impaction of fragment, proximal shift. Prepatellar bursa is also known as housemaid's knee. Coxa vara in one leg and coxa valga in other leg. This condition is known as wind-swept deformity, which is seen in scurvy. Fixed flexion deformity at hip, we do Thomas test, which shows exaggerated lordosis. Terrible triad of elbow includes elbow dislocation, radial head fracture, and fracture of coronoid process of ulna. Most common dislocation in pediatric age group is elbow dislocation. Second most common dislocation in adults after shoulder dislocation is elbow dislocation. That means in adults most common dislocation is shoulder dislocation and secondly elbow dislocation. In children most common dislocation is elbow dislocation. Osteoid osteoma is a radiolucent nidus surrounded by cortical sclerosis. Best investigation to do is CT scan. Cubitus varus deformity, also known as gunstock deformity, complication includes malunion of supracondylar fracture humerus. Iliopsoas muscle is present at the lesser trochanter of femur.